Good evening, everyone, and welcome back to Facts Talk. I'm your girl Lee. So, today we want to talk about something that many people misunderstand: narcissistic personality disorder, or NPD. You may have heard of the word narcissist, used to describe someone who is full of themselves, but the real disorder goes much deeper. Understanding NPD is important because it affects not just the person who has it, but also the people around them: family, friends, co workers, even children. What is NPD? Narcissistic personality disorder is a mental health condition listed in the Diagnostic and Statistical Manual of Mental Health Disorders, DSM 5. It involves a long term pattern of 1. An inflated sense of self importance, 2. A constant need for admiration, and 3. A lack of empathy for others. Some common signs of NPD include believing they are superior or special, exaggerating achievements or talents, taking advantage of others to get what they want, and having difficulty recognizing or caring about other people's feelings. It is important to know that this is more than just being confident or proud. It's a disorder that affects daily functioning and relationships. Types of narcissism. There are two main types of narcissism: the grandiose narcissism, vulnerable narcissism. This is harder to spot. These individuals may seem shy or insecure. They still feel entitled and want admiration, but they hide it behind sensitivity or low self-esteem. Both types involve a fragile self-image, even if it does not seem obvious on the outside. Impacts of relationships and society. So NPD can seriously affect personality and professional relationships. People with NPD may 1. Manipulate or use others for personal gain, 2. Ignore others' feelings, leading to emotional harm, 3. Become angry or defensive when criticized, and 4. Struggle with long-term relationships or commitments. At the same time, they may experience deep feelings of shame, insecurity, or depression, especially if they don't get admiration they crave. Loved ones may feel confused, hurt, or emotionally drained. And
causes and risk factors for NDP, or narcissistic personality disorder. So there is a question of what causes NDP, and to answer that question, there is no single answer. However, there is believed to be a lot of factors that contribute to someone having NDP. Now, factors such as genetics. Now, certain personality traits linked to NDP, such as entitlement and grandiosity, have a hereditary component. Now, studies suggest that grandiosity is about 23% hereditary and entitlement about 35%. Now, environmental and childhood experiences plays a big part in this. Now, parenting styles marked by their excessive admiration or excessive criticism that don't align with the child's actual achievements can contribute to NDP development. Now, specific parenting behaviors linked to high narcissism include overprotective or helicopter parenting, lack of warmth or emotional support, few limits or boundaries, evaluation or unrealistic praise, and maltreatment or abuse. Now, negative experiences such as rejection, trauma, or bullying can cause or increase the risk of having NDP. Excessive praise without realistic feedback can also foster an inflated self image disconnected from reality. Psychological and temperamental factors. Now, this is where people with NDP often mask deep insecurities with facade of confidence and charm. Now, control context matters. So, narcissism tend to be high higher in individualistic cultures that emphasize personal achievement and independence compared to other cultures. Now, going on to the biological factors. So, emerging research shows elevated oxidative stress in people with NDP, suggesting that biological stress may contribute to the disorder development. Now, NDP likely results from a combination of genetic predisposition, early environmental factors, temperament, and cultural influences rather than any single cause. Now, treatment of narcissistic personality disorder. Now, treatment such as psychotherapy, which is the primary treatment. Now, psychotherapy is a cornerstone for or of treatment focusing on helping individuals develop a realistic self image, providing or to improve empathy and build healthier relationships. Now, common therapeutic approaches include cognitive behavioral therapy, which is CBT, and this helps identify and change distorted thinking and maladaptive behaviors. Now, psychodynamic therapy explores consciousness or unconscious motivations and early life experiences influencing current behavior. Now, other things can be used to treat narcissistic personality disorder, such as medication. However, no medication is specifically created to treat NDP. No medication like antidepressants, anti-anxiety drugs, or mood stabilizers may be prescribed to manage co-occurring conditions such as depression, anxiety, or mood swings. Now, for additional support, stress management techniques such as mindfulness, medication, or yoga may help to reduce emotional reactivity. Group therapy or family therapy can provide support and improve rational dynamics. No challenges in treatment. Many individuals with NDP do not recognize their condition or seek treatment unless prompted by related issues such as depression or substance use. Now, diagnosis can be complicated by co-occurring mental health disorders like borderline personality disorder, bipolar disorder, or substance abuse.
I don't mean for be this way. I don't mean for be this way, you know. I know I come off like say, I feel like I'm better than people. Yeah. I guess I mean they talk about in Proverbs 11 verse 2 that says when pride comes. Yeah. But for tell you the truth, enough time I not even like myself. I always feel like I have to show people say me as somebody. Like if nobody no pay me no mind, it's like me no exist. And if you criticize me, it burn me deeper than it should. Yeah. Me no mean to talk about myself all the while. I know say me no care. Me just me just don't know how to show it sometime. Mm-hmm. You see all in Philippians 2, 3 to 4, we talk about do nothing out of selfish ambition or vain conceit, rather in humility, valuing others above yourself, not looking for your own interest, but each of you to the interest of others. Hey, you know them I talk about humility. People are talk to me about them problem, and all in my brain, me start to think what me can say for look smart, or how me can turn the convo back for me. Yeah, yeah. Me know it sounds selfish, and maybe it is, but deep down, me just afraid, me afraid you are gonna say the part what make me weak. As Proverbs 16 and 18 says, pride goes before destruction, and a haughty spirit before a fall. Hey, hey. Me always act like me strong. But we tell the truth, me full of doubt and full of fear. Me always need some praise. Me always need somebody to tell me say me good. Can't lie. That mess with me head. Mm. And me know it hard to deal with me, you know. Yeah, me know. Me drain people. Yeah, drain people. Mm. Me could have stopped it though. Yeah, me wish me could have stopped it. Just be a normal and be present. But me a try now. Me a talk to people. And therapy and them things. Yeah, therapy and them things. Me no want to be this narcissist. No sir. Me a good human being. I have my flaws. But me really I try. Me really I do. Yeah. James 4 verse 16. But he gives us more grace. Therefore it says, God opposes the proud, but shows favor to the humble and opposes the proud. Yeah, me I try. Did you know that in Jamaica nearly 1 million adults suffer from personality disorder? According to the Sunday Gleaner, published January the 16th, 2011, Professor Frederick Hicklin and clinical psychologist Vanessa Paisley have concluded that personality disorder in Jamaica is prevalent. Their finding is constrained in a scientific paper prepared for presentation, which was done at the Society for the Study of Psychiatry and Culture in Seattle, Washington, in June of that said year. Data from a four-stage stratified random sample method suggested that 40% of the Jamaica population then was showing signs of personality disorder ranging from ages between 18 to 64. The research further went on to state that a public education program should be used to utilize all forms of media in enlightening persons about the various mental health issues. He also looked on other countries in the Caribbean, such as Cuba, which has implemented a behavior modification techniques. In concluding, narcissistic personality may have been among one of those many personality disorders within that research carried out. It is a serious mental health condition. It may not always look the same on every person, but it causes real life struggles. Let's replace judgment with understanding and make mental health a conversation for everyone so we can all be a part of it. Thank you.